Rambam Health Care Campus is the largest hospital in northern Israel, and it's a tertiary care center, level 1 trauma center, and we have collaboration with basically countries from all around the world, and we have people that are partnering with us, basically again from everywhere. Rambam, for whatever reason that I cannot really explain, was never had a stronghold in South America, in Latin America. And 6 months ago, we were lucky to cross with one of the representatives here, Monica, and she opened our eyes with the abilities of the community, the abilities of the medical facilities, the academic facilities. So we decided to invest and to penetrate the area. So this is my first time in Mexico. We have never done anything in Mexico yet, but we started with Brazil and Sao Paulo, and now we are at Mexico. The idea is to build cooperation and to find a partnership. So one of obviously partnership within the community, but also with medical facility, with academic medical facilities. So we were lucky to be able to go to the institution over there. We spent the morning over there, had discussion with the leadership of the hospital. We had the tour throughout the hospital, and we discussed area that we can collaborate and do things together. It's exchange of knowledge, and I think that us as medical people, we understand that the knowledge that we gathered is not ours, it's for the sake of humanity. We have to share. So this is one of our philosophies, this is one of their philosophies, and in 2023 and looking into the future, you cannot work by yourself. You have to work and build these partnerships. So we already noted some areas that we can collaborate on. So obviously on the clinical side, in the emergency room, and on the IT side, we have our own computerized systems that we can share and talk about. And on the research and innovation side, so there's so many places that we can go to. So and there's openness from both sides. So we haven't signed an agreement yet. This was the initial first visit, This was getting acquainted, and see each other, talk about each other's facilities, and talk about the capabilities. I think that maybe much more important than signing an agreement, we shook hands, and I think that the action items out of it is good action items, how we can collaborate and do stuff together. And now we will build the context of all this. And I'm sure that within a very short period of time, we will do stuff together. We have at Rambam, as the biggest trauma center in Israel, we have established about almost 30 years ago, we have established the International Teaching School for Emergency Preparedness and Mass Security Events. And throughout the years, we had people coming over to learn how to prepare the system. Some of them through Mashav and the Foreign Affairs, some of them directly with us. And all the time we have people that are coming over. There's soon going to be a course of 2 weeks that people come from all over the world. And also we had fellowships. People are coming for fellowships from South America. We have people coming all the time. Okay, so first, us as in the medical facilities and our hospitals, obviously the first mandate that we have is to treat patients. But we believe that at the same level is to push the envelope, meaning to do lots of research of innovation. First, because it goes together with the quality of your clinical work. If you do lots of research and innovation, you do your clinical work is much better, your staff is much better. So we are investing a lot in this. You asked specific about cardiology. So we see a big change in cardiology during in the last few years. Heart attack was one of the biggest killers, and we know that if you look at data from the world, the mortality from heart attack was the highest in the world. But because we have many solutions for heart attack with catheterization, putting stents, and so many other things, we see that the causes of death because of heart attack is going down. And for instance, now oncology cancer is higher than heart attack. But we see a different on those patients, because now that the patient lived to be older after having a heart attack, because all of the solution, they develop heart failure, right? So we see a huge change on the way that you have to treat those patients, because we get older, their heart is not working as well as it should be, and then you have to look for a solution, how to deal with it, and there's many solutions around it. Obviously, initially is drugs and many other things that you do, but then sometimes this is not enough, and you have to basically help the pump, right? Of the heart is a pump. Looking at heart transplant is always a solution, but it's a very difficult solution, because first you need organs for that, and second is all kind of issues of immunology. How do you prevent this new organ to be accepted by your own body? So the idea is that what we do is implant a device that can basically work with the heart. Is a mechanical device, and it's what we call assist device. The heart is working, but there is a pump working parallel to that, and the patient can live with it without any problems. But we are going to be much more advanced. The idea is, how do you fix the actual muscles of the heart? And by using stem cells, and in the future, you will take a cell from the patient, skin cell. We take it back in its history to become a stem cell, and from that stem cell, we will manufacture, for instance, cells of the left ventricular of the heart, right? So then you don't have any problem of immunology, because this is your own cells. And there's lots of research, and Israel is known, and Rambam especially, as very advanced in the area of genomics and stem cells. So this is the future. We'll probably will be able to prepare areas of the heart, because they got ischemia and not working well because of the heart attack. We are starting, and there are other places that we collaborate around the world. We're starting with clinical studies. So already studying some studies on people. Yeah. So, but I think that there's still a long way to go. But we, on the other hand, we managed to because if you look at the heart, it's not one kind of a cell. It's about 7 or 8 different cells, because there's the muscle, and there's the conductions, and there is many cells that basically make all the heart. So what we do is we can now differentiate this stem cell, that you will do this specific cell that you want to do in order to basically fix the heart in that area. So this is one thing that we do. Also, when we talk about drugs, and this, in order to build a new drug or to make a new drug, it's a huge process. But at the end of the day, once you've done through all the process of making this new drug, the only way to test it is on a man. And sometimes it's good, sometimes it's not. Something has side effects. So what we can do now is take those stem cells, the cells, and make what we call organ on a chip. So we can build 3D organ, very small, for instance, of the lung or of the heart, in a disc, and then we put drugs on that, and we could see the effect of the drugs. So you can shorten and make the investigation of making a new drug much shortened and less expensive. To have a new drug costs huge amount of money. It's already done. So all kind organ of a chip, of hearts, of lungs, of corneas, and then you can really test effects of different drugs on that organ that is basically a real organ. Many of the therapies, there is no evidence, medical or scientific evidence, what they do, how they work, can you make them better? And we were lucky to have Dr. Luria, that is a specialist in the area of cannabinoids. And what we've made, we took all the services that use cannabinoids, so gastroenterology, neurology, pain, cardiology, and now they work together as a team, and they are trying to find the specific cannabinoid that will do a specific effect on the body, and look at the evidence for that. So it's to be totally academic, not wishful thinkings. So lots of work is done around this, and there lots of cooperation around the world. So what we say, I don't know, you'll see that the emblem of Rambam is the tree of life. That's the emblem of Rambam. And we say that the trunk of the tree is medicine, and the branches of the tree are bridges to so many other things, like bridges to peace. So first, people get positioned in the hospital according to their abilities, not according to the gender, not according to the religion, and not according to anything else. And we have high position staff of the hospital in all sectors from all religion. We work together. There was never a problem. Even now, which is really challenging times, inside the hospital, we work together. Then, obviously, the Palestinian authorities have limited medical capabilities. So we get patients from the from the Palestinian authorities, and we get medical staff from the Palestinian authority to train them, because we believe that if we train them, they will go back to the place that they come, and they will improve the medical system over there. And third, everybody knows that Israel was in a war situation with Syria, but with the events that were happening in Syria until quite recently, the Israeli government decided to open the border between Syria and Israel, and we used to get casualties, thousands of casualties from the events in Syria, without asking any questions, what side, why did they got injured, and we used to treat them. We used to get casualties initially, coming sometimes in very serious condition, in a coma, and we used to go to get them into the hospital, treat them. They used to wake up. Suddenly they are in Israel. They thought where the demons are, and we are not. Everybody that comes into our door, we are medical people, and this is something I believe across the world. We treat them. We don't ask questions. We don't ask why and what. We give medical treatment because this is our commitment, the commitment for mankind to treat patients. And I think that this is extremely strong at the healthcare system in Israel as a whole, and obviously at Rambam. Israel is a humanitarian country, and I think that even with all the events that are happening around Israel, and I don't want to be on the political side, but the IDF and everything, I think it's looking at armies across the world. Even now, I think that the IDF is one of the most humanitarian army in the world. Rambam is called after the Maimónides, Rambam, Rabbi Moshe ben Maimon. You said that, if you read Rambam's literature, he was extremely innovative, extremely innovative. His ideas, you can see that, he foresee the future in many ways. We take lots of pride of being called Rambam because of that. Even said in his literature that think 1100s, he said that you cannot separate body and mind. how innovative this is for his time. Looking to the future, so Rambam Campus is giving services to the northern part of the Israel, 2.5 million people. But we know that within until 2048 and 2065, there will be much more need of the medical facility. So we are doing now a new master plan of the hospital, looking at the needs of the trying to foresee the needs of the medical facilities in northern part of Israel. We will continue to be the only tertiary care center and level 1 trauma center. And one of the things that we are extremely involved with now is doing a new master plan. So Rambam is now 1,100 beds, but will be 2,700 beds. Rambam is now built around 180,000 square meters, and it's going to be 5 times as big, more than 900,000 square meters. So we will have the infrastructure for all the development that will be done in the future. Also, as you see, we call ourselves not Rambam Hospital. We call ourselves Rambam Health Care Campus. And because we believe that obviously the old approach to medical facility is, people go there because they are sick and they want to be healed. But I think that there is more to that. Part of the thing is, how do you prevent illness? How you promote healing? How you promote health? And all those things is part of how you trying to foresee the future, and even the actual hospital. The creating a healing environment, it's part of the process, right? We have to think differently, and I'm sure that we'll have many areas of development in AI, artificial intelligence, that will affect the way that we do medicine, the way that we the gene therapies and many other new therapies that will come in, how we will do prevention with more immunizations and so many other things that I think this is the future. I think that if you look throughout the years, the life expectancy is coming higher and higher because of all those advancements. All this program that we have done, we took all the managerial layer of Rambam. We have 6,000 workers. About 1,000 participated in the process, in each and every area, to trying to see what future will hold for us and try to plan ahead. And obviously, we made the infrastructure. If something will change, it will be very simple to modify our master plan. Okay. We are a government hospital, but the government doesn't support any research and development. All the money for research and development is for us to find. So having an extremely strong community over here, extremely impressive community, very linked to Israel. And I think that we are looking for people that will partner with us, join our vision, and help us fulfill our vision. I can sit as the CEO of Rambam and cry because the government doesn't give me. We do not deal with problems. We deal with solution. And we, working together, this is the solution, right? So those partnership is the solution to create or to basically make this vision come true, because Rambam is looking for the future. Obviously, we need a stronghold in Mexico, and this is one of the things that we want to do, to open a Mexico Friends of Rambam Health Care Campus. Obviously, this is part of the thing that we will do. This is my first visit over here, and this is, we are penetrating and getting the community will know about Rambam. There's a first step, and we probably in the really next future, very close future, we will come again and again, and also make an event and to get people to participate. And maybe the most important, come to see with your own eyes. Everybody has an open invitation to come to Rambam, And I'm sure I promise that we'll host you and see the stuff that's done there. It's mind-blowing. I'm working at Rambam for 37 years. It's an amazing place, amazing stuff. I could not ask for better. It's exciting to meet new friends, to build new partnership, to build new friendship, and you know, I've gone around the world. I think that the place is extremely impressive. The community is extremely impressive, and I'm sure, I have no doubt, that we will have and we will do things together.